Most welcome.
Well, let's turn to health matters now. Some researchers have picked signals that Nigerians are taking twice the World Health Organization's recommendation of 5.8 grams of salt per day. For this reason, interest groups on salt intake reduction in Nigeria are asking the people to reduce salt consumption. Senior correspondent Jacqueline Ogo reports.
The World Health Organization says for the past 20 years, heart-related diseases known as cardiovascular diseases have been the highest causes of death globally. Top amongst them is hypertension. A 2019 World Health Organization statistic puts the number of persons living with hypertension in Nigeria at an ugly figure of 19.1 million. Doctors say too much intake of salt precipitates hypertension. A coalition of non-government organizations disturbed by the statistics says the people must have a more serious disposition about reducing their salt intake, and the government must regulate the salt level of manufactured foods and punish violators of the stipulated standard.
The progression of the hypertension with exercise.
Dr. Jerome Mafeni became hypertensive at the age of 20. He advocates against high salt intake and has been able to make his family comply.
I think we've all been acculturated and customized to eating foods high in salt. And that's a big danger because as a consequence, we are not aware that the recent increase in non-communicable diseases, particularly high blood pressure, strokes in young persons, kidney disease in young persons, cancers in young persons that are killing our populace could actually be linked to this high salt consumption.
Dr. Mafeni wants the government to come to the rescue.
What has happened is that NAFDAC is now taking seriously the need to update existing regulations around salt to promote targets, specific targets for particular food groups, particularly for commercially produced foods, so as to reduce the amount of salts that the public consumes.
An assistant project manager of the Cardiovascular Research Unit of the University of Abuja and its teaching hospital, Vanessa Alfa, says Nigerians must deliberately cut down on salt intake, especially now that children are coming up with hypertension.
There's a lot of work to be done. First of all, the knowledge gap for the ordinary Nigerian is very huge. If it's for people, stakeholders, medical doctors, people in the research field, a lot of enlightened people and patients who have been to the hospital, who have seen the doctor and know that, okay, salt is a problem. Yes, those ones will have knowledge. But what about the common man on the street? What about the person that, the malam that is selling suya down the road? What about the woman that is cooking her amala in her shop to sell to people? A lot of these people don't know that excessive salt is bad. And at the end of the day, when they start having issues, they may not be able to get care on time. And then from just excessive salt, it can degenerate to having high blood pressure, and from there generate to hypertension. So for me, I think knowledge is key. We need to do widespread awareness. We need to get people to learn how to eat healthy. We need to get people to reduce the amount of salt they eat in the foods they cook themselves, and in the snacks and foods they buy from outside, processed foods.